everybody, welcome back to another episode of Facebook Live. We are here today at Berkeley Prep as the Buccaneers take on the Tampa Catholic Crusaders, and we are joined here today by a very special guest, none other than the director of our sports medicine program, Dr. Seth Gasser. Dr. Gasser, how are you?
I'm doing great. Thanks for having me here, Kyle.
Dr. Gasser, you are a sports medicine orthopedic surgeon, and now orthopedics is a very comprehensive practice. It entails a lot of different specialties, relating to different body parts. You got the spine, shoulder, elbow, hip, knee, foot, ankle, hand, wrist. I think that's about all of them. But then you also have specialties like sports medicine. And, you can see a lot of those specialties within sports medicine. And I think it stands to reason that some patients may be a little confused sometimes about who to see compared to a sports medicine physician such as yourself, or a foot ankle physician, or a regular hand wrist surgeon. So we wanted to delve a little bit deeper into sports medicine and further provide some definition to the term, and maybe alleviate some of that confusion among our patients. So what exactly is sports medicine, and how does it differentiate itself from the other orthopedic specialties?
Well, Kyle, it's a great question. Sports medicine is really a subspecialty in orthopedics that deals with the treatment and prevention of sports and exercise-related injuries. The thing that makes sports medicine special is that sports medicine orthopedic surgeons have to undergo additional specialty training to call themselves a sports medicine specialist. So the normal path to become an orthopedic surgeon involves typically 4 years of college, 4 years of medical school, and a 5-year residency program. If you want to call yourself an orthopedic sports medicine specialist, you have to do a year of additional training in sports medicine. And in addition, you have to pass an additional board certification exam above your regular orthopedic board exam in sports medicine.
And now, we said that you were the director of our sports medicine program, so I'm sure that you'll be more than happy to kind of talk our program up. And can you explain a little bit about how our sports medicine program at Florida Orthopedic Institute sets itself apart from other sports medicine practices?
Sure. Well, Florida Orthopedic Institute by itself is a very unique private practice orthopedic group. We're one of the largest groups in the southeastern United States, approximately 50 physicians, and all of our doctors have some sort of subspecialty focus in one of these other fields of orthopedic surgery. Being sports medicine orthopedics at FOI allows you to focus solely on your subspecialty. And the thing that's unique about sports medicine is that it's a multidisciplinary approach. It doesn't just involve the orthopedic surgeon. We have primary care sports medicine physicians. We have athletic trainers. We have physical therapists. We consult with sports nutritionists and sports psychologists. So it's really a multidisciplinary field. And being at FOI has allowed me to focus solely on sports medicine during my past 26 years here.
And now, do you have to be, it's called sports medicine, but do you have to be an athlete or involved in a particular sport, whether that's professional, collegiate, high school, intramural, recreational? I could go on, but I won't. Do you have to be active and involved to see a sports medicine physician?
Well, that's a great question too, Colin. The answer to that is really no. We do take care of all of those athletes at FOI, from the professional level to the child athlete to the weekend warriors, and just to the recreational athletes. But sports and exercise-related injuries occur in all people of all ages and aren't always necessarily related to sports activity, and we take care of all of those patients.
And now, how would one of those patients know whether to see a sports medicine specialist such as yourself, or a different, or a regular orthopedic specialty surgeon such as a foot, ankle, or a hip, knee surgeon?
Well, there is some overlap, and it can be somewhat confusing for the patient. But in general, the sports medicine patients suffer their either overuse or acute traumatic injuries in the endeavor of some sort of exercise or sporting event, or they can have a similar injury from an accident such as falling off a ladder and twisting their knee. And so if they're young and active, our focus is really to maintain activity and a healthy lifestyle in those people. If you're older and your symptoms are more arthritic, you're probably not necessarily suitable for a sports medicine specialist.
And what are the most common sports medicine related injuries that you see on a day-to-day basis? So you come in on Monday morning, you walk in a clinic, what do you expect is going to be the most common injury you're going to see that day?
Well, there's really two main groups of injuries that we see: the acute traumatic injuries, and most of those are sprains or strains. More severe injuries such as that involve things like anterior cruciate ligament tears. And then there's the other group of injuries, which are chronic overuse injuries that we see as many of as the acute traumatic, things like shin splints, tendonitis, bursitis, muscle strains, and those types of things. So we see all of the above. The most common joints that particularly present to sports medicine are knee and shoulder, but we also see elbow, ankle, etc. And like you said, there can be some overlap with some of those other subspecialties.
Dr. Gasser, thank you so much for being with us here tonight. Is there anything else about sports medicine that you think a patient should know that we haven't tackled today?
You know, I think in general the patients need to understand, one, if they're seeing a sports medicine specialist, they have extra training. The vast majority of treatments that we do and patients we treat do not require surgery. Only 10% of the patients we see need surgery. It's a coordinated multidisciplinary approach, and we're committed to giving those patients state-of-the-art, compassionate care.
Dr. Gasser, once again, thank you for being with us here tonight. Thank you for dedicating your time to our high school athletes and keeping them active. For the folks at home, thank you for tuning in. Keep tuning in, and we will stay keeping you active. Thank you, and have a good night.